now. So I'm Charlie Tulloch. I'm a Victorian AES committee member and AES board member as well. Really happy to be facilitating today's session and glad to have Eleanor Williams with us to lead today's session. So Eleanor is the Director of the Centre for Evaluation and Research at the Department of Health and Human Services in Victoria. And she's also the current convener of the Victorian and Australian Public Sector Evaluation Networks. And the focus of today's session is to talk about how DHHS has responded through the rapid review process to the range of challenges that COVID has thrown up over the past few months. Today's session, we're expecting will run for about 60 minutes in total rather than the 90 minutes, so we'll make it short and sharp. Feel free to post any questions on the chat as we go, and I'll rudely interrupt Eleanor and share some questions as the session progresses rather than waiting till the end. I think that's the best way to tackle questions as we go, so don't be shy. And at this point, I'm glad to hand over to Eleanor and thank her for her time and consideration, given she's been working extremely hard over the last few months, and look forward to hearing from her about the DHHS's response.
Thanks, Charlie. Thanks for the introduction. And welcome, everyone. I was so excited when we got the attendee list. Like, we've got a really fantastic group with us today, and I was really thrilled to see lots of familiar names and now faces now that we've started the session. I'd also like to acknowledge we're meeting on all sorts of Aboriginal land today and pay my respects to elders past, present and emerging. As Charlie said, I'm happy to take questions throughout. So I was really excited to take this opportunity to kind of share this emerging approach that we're taking to running kind of rapid evaluations during the COVID response to try and capture these emerging service and practice changes. I know there's lots of interest in the sort of practice. I might even just kick off with that initial question. Charlie and I were talking about whether it would be useful to run a little poll as a starter, because my presentation is mostly focused around the approach we've taken. I also touched in a couple of points on the high level findings. And I was curious from attendees about whether you're most interested in hearing about the approach we've taken or the findings that we're starting to see. So Charlie, do you want to deploy that poll and then maybe just let me know? I don't know how you'll get the responses. We'll find out. You're on mute as well, Charlie, but I'll trust that you're on it.
I think the poll might have already been up when everyone logged in. So we've actually already got the answers from a lot of people. So
brilliant. Which way it's leaning?
Yeah, so people are interested in knowing about the process. So that's 91%, and desperate to know what the findings were is around 25%. So we're interested in the process more than necessarily the outcomes.
Perfect. That was actually my assumption. So that is great. I just suddenly had I wanted to check that in with you before we kicked off. All right. Look, I'll launch straight in. As I said, ask questions as we go, and I'm happy to sort of break down any points if I'm going too quickly. Oh, there we go. I've got the poll as well.
There we go. I just share results. So that's the results. I can end that. So we jump to your presentation.
That's great. Thanks, Charlie.
Cool.
So to kick off, this is no surprise. So the Department of Health and Human Services is right in the middle of this COVID response, as you can imagine. And I think a lot of us were sort of hoping by this time in the year, we would be less involved in a COVID response. But as you can imagine, this has required a really rapid and really sort of fundamental shift in how both the department delivers its own services, but also how we work with our other service providers to adapt our services to meet the changing needs, particularly physical distancing requirements. But there's sort of a series of public health efforts that we've had to make during this time. So really early on, I won't go too much in the governance of it, but really early on, the senior audiences who are involved in decision making from the department level and also in a cross-departmental structure which is called the missions approach. Senior decision makers identified this need to try and pick up what we were doing differently and how well it was working. So we were called in really early to work not only within our own department, but across multiple departments to talk about how you might try and capture these innovations, and recognising that decisions are being made on a very, very fast pace, often called like cadence or routine or rhythm, where a change is being made very quickly, and we need to make a call about, are we rolling this out to all service areas or are we adapting it? And these decisions being made on a faster time cycle than usual. So So the idea was capturing the service and practice changes where they look positive and trying to spread them out or make sure they were maintained, particularly as I think we were wondering whether we were going into a recovery phase or an ongoing response. And I think at the moment we're in an ongoing response, as you know. So this slide, I know it's a little bit busy, but I'll talk through the different elements. This tries to summarize the sort of big picture strategy that we were trying to deploy. So there's hundreds of service and practice changes that we could be looking at. So the first job was to go, well, which ones are we going to look at? I guess the decision was made. We were particularly looking for the service and practice changes that looked like they were having some kind of positive impact, that somebody out there in terms of the stakeholder environment thought this was a good thing worth doing. The second criterion, I think for an evaluation audience, this always gives you a bit of it seems a bit confronting. We're saying it needs to be in place for 4 weeks, as if that sort of says it's established. And usually, as you know, we might say 6 months, 12 months, 2 years is when a change or an intervention has started to embed. In this case, we were just saying at least 4 weeks because we were getting a lot of calls. Could we look at a thing, we're about to implement it next week, could we start a rapid evaluation on that? And we were saying, well, it's probably better to try and look at the things that have started to roll out, at least enough so you can start getting a bit of traction on what's changing and what it's doing. The third point is that government has the ability to decide or influence the service design. So this is to try and avoid looking at things which were, something one hospital was doing in one location and it was their choice whether they did it or not. We're trying to look at the things where government has a real influence in the policy or the service design. And the fourth we added, which is that it feeds into a known planning or decision-making process, which is to try and get the maximum value out of these rapid evaluations. A little bit further down in this presentation, I will go into sort of trying to situate this a little bit into evaluation theory. But at the moment, I guess I'm trying to describe just the pragmatic approach that we took to trying to respond to the immediate need that the decision makers were putting to us. So the middle column just talks about what questions are we seeking to answer. And I think people who've worked in kind of developmental evaluation, these questions would sometimes be described as what next? And so the what is about what are the departments and funded agencies doing differently. So this is just the basics of what's happened. The second, we describe this in kind of layperson's terms rather than technical terms. We're saying, what is the impact of these changes? I know for a lot of people in the evaluation space, impact actually has specific connotations about effect sizes and how you measure impact. This is very much impact in the common usage, which is what's happened because a service or practice change has occurred. And the third one is what aspects of the changes should the department seek to keep on or extend. So that's the sort of what next. Now that we know that, what should we do with this information? The basic recommendations. I've included the criteria for assessing the strength or weaknesses of change here. This is really interesting because I guess for a lot of evaluators, certainly in my position, you often want your senior stakeholders to really engage in these questions. And in this situation, we actually had deputy secretaries debating what should be the criteria we're looking at, which is really positive. It does also sort of influence the language we've used here might seem unusual or uncomfortable, but it's sort of the language that was preferred. So look, I won't step through these individually so much, but, oh no, maybe I will. So the first one, again, ability to demonstrate measurable impacts and outcomes. This was really just trying to test, can we see anything change? Like, is there something we could see change? And it's a bit different than criteria, how we usually use them. Usually we're looking at an intervention, we're trying to say, is it meeting its objectives? In this case, we're more trying to understand what the strengths and weaknesses are of the model, because we've got lots of different service and practice changes. Some will be stronger in one, and they've been implemented and designed quickly. They're going to work differently in different circumstances. So it's trying to understand what sort of service and practice change is this. So some of them, for instance, one of the projects we looked at is the Housing Establishment Fund, and some will be familiar with that. That's the program that supports homeless people to be housed in hotel accommodation, and now it's become for a very extended period. Usually it's a very short intervention. That does a lot to reduce risk, and some would say it's improved the client service experience. But in terms of things like increased efficiency, of course, it's like hugely expensive and it doesn't perform well on that criteria. But what we're trying to understand is what things is it good at and what things is it not so good at. So when we're making decisions, we understand those different variables rather than kind of assessing, is it a good version of a program? It's really, it's a different sort of conceptualization of those criteria. So as I said, so we've got ability to demonstrate measurable impact. There's reduced risk or increased safety. I'll show you a little rubric further down too about how we've kind of tried to lay this out so an audience can see this as well. There's increased efficiency and effectiveness. These are pretty standard ones that you look at. Increased empowerment and flexibility for frontline staff. This is trying to understand what the impact was on the workforce. And below it's increased empowerment for partners and community. And again, this is sort of about other stakeholders of the program. F was about improved client experience. And then we have the two, which are about ability to be sustained over the longer term and ability to be scaled up or rolled out. So some things we look at will be smaller localized interventions where those questions are particularly relevant. So to give you a sense of the sort of topic area, we are really trying to cover a lot of ground. I mean, the department covers a lot of portfolios. So we're trying to make sure that we're picking out service and practice changes from each portfolio to start to get a sense of what's happening in each. And to try and also get a mix of different kinds of service and practice changes. What we're finding is a lot of the service and practice changes we've identified are about how you move a face-to-face service to a telephone or a remotely delivered version of that service. So we've tried to pick up a couple of different examples of how that works. And again, I won't go through this in great detail, but to give you a sense of the sort of topics we're looking at, we've been looking at the use of telehealth for perinatal services. So that's a really interesting one in the health space, because it's about how do you avoid having pregnant women coming to hospitals with potentially an increased risk of infection. It's a useful starting point because it's quite a discrete service, and the service and practice change is actually really clear. You know, usually you would come face-to-face into the hospital. Now we're doing at least some of the appointments and the lower risk appointments for lower risk women via telephone predominantly. In homelessness, we looked at the temporary extension of the Housing Establishment Fund. That's what I mentioned earlier. That's where homeless people go and stay in hotels for a period of time. And in children and family services, we looked at the move from face-to-face to remote delivery for evidence-based programs and the common element approach, which are two specific manualised kind of processes in the children and family services space. They were selected particularly because how the service is delivered as business as usual is really well defined. So it was a good, easy space in that portfolio to understand what had changed. You know, how do you usually do it and how are you doing it now? I won't go through the bottom row in such detail, but just to give you a sense that now we're trying to move into mental health, family violence, some of the spaces that we haven't looked at. And one thing we're looking at that's a little bit different than the other reviews is also about how communications are working with culturally and linguistically diverse communities. As you will have seen in the media, there have been lots of challenges in that space, and this is really trying to get an understanding of what's working in the ground. It's a bit more like, it's a bit different than the other studies in how we're conducting it. We're doing it as more an observational study of some roundtables and a bit of a deep dive into the data around communications and transmission of COVID-19. So I'm glad everyone was really interested in the approach taken, because this is a bit that's really interesting to me, because it's, I guess you can lay out the best laid plans for how a 4 to 6 week review would work. And this is the sort of clean version of how it's meant to work. And then I wanted to talk a little bit about what gets in the way of this working in practice. This also makes the process look really linear. And as you know, when we've got teams of between 2 and 4 people doing, well, actually I think we've gone up to 5 on one of them. We've got multiple people working, which means actually it looks like more of these steps happen in parallel rather than that sort of waterfall approach that's shown there. So I think the components are pretty standard elements of a rapid review of almost any time. You know, you do a document review, you think about the program logic. We do a pretty intensive period of data collection and analysis, and for most of the projects that involves a service provider and a service user survey. Stakeholder interviews, as many as we can sort of squeeze in over the period, and any of the quantitative data that we can get our hands on, we try to analyse and use, particularly to validate points that are coming out from the surveys and the interviews that we're undertaking. I've also flashed out here, we've actually only done one case study so far, like one detailed sort of case story approach, which I'll touch on later. The idea is, where possible, if we hear an example of one service provider who's doing something in a particularly creative or interesting way, to try and capture that, to give that sense of what's happening on the ground. And I'll touch on one later, which was the Koori maternity service, which really helped kind of make sense of what the change looks like in practice. And similarly, the final point here is to say that we report, and this is probably the biggest understatement, because actually we're really trying hard to think of creative ways to communicate the findings, because if you're working at this pace, a standard, 20, 30, 40 page report is not going to fly. It's not going to hit the target audience. So we're really thinking about how we can communicate the findings in different ways to hit off those different audiences. And I thought for an AES audience that you might particularly be interested in the things that get in the way of really conducting something in this kind of time frame. Like we generally, as you know, evaluations generally occur over maybe a minimum of 3 months. And I guess lots and lots of projects are 12 months, 1 year, 2 years, 3 years. So I guess if you're trying to work in a 4 to 6 week project, there's lots of things can get in the way. And these are sort of 5 that really jumped out to me as things that we've sort of seen across multiple projects now. So one is the challenge in confirming the scope and focus. We've had a pretty clear directive from our senior executive audience about what these projects are and what they're meant to achieve. But obviously once you get out with a program area, and they've got hundreds of questions they want to explore about what's happening and what's changed, and things that are going well and things that are going badly. And we have to put a lot of barriers around that in order to be able to deliver the projects. And particularly that question, we're so used to, as evaluators, looking at the things that are working and the things that aren't working. In this case, we're particularly looking for the things that are working well and trying to understand why they're working and how they can be expanded, which is a bit of a different mindset. And it does mean you have to sort of not go down a whole lot of paths of inquiry that you would usually consider. So that's been a real challenge. And this is one that surely everyone can kind of empathise with. Delays in system level data access. I mean, we usually have problems getting data within the couple of month window that you usually got. In this case, the good news is we've got a pretty big stick to wield to say the secretaries want it. We've got ministers who want to see this. We really need to get to the data. But it still doesn't get in the way of, we still need to do all the right things around privacy impact assessments, negotiating with data custodians, all the normal things that need to happen in requesting and receiving data. We've got, again, as you can imagine, we've got stakeholders and team members with competing priorities. So we haven't been able to take our whole team offline to do this. So you've got people who've got other long-term projects that they need to manage in parallel. But also in this current stakeholder environment, you've got people being taken offline to coordinate testing sites and responses in public housing and all sorts of other competing priorities in the department, which means somebody who was your senior stakeholder is now offline for the next 3 months when you're doing a 4 to 6 week project, and you now have to navigate to the next person. And that's not, I'm not even mentioning competing priorities like homeschooling your children and dealing with family members who are in aged care who need to be supported as well. Those other normal competing priorities that we deal with. I also want to point out emerging stakeholder priorities and points of interest. Quite often, as you can imagine with the Housing Establishment Fund, there's so much interest in a lot of aspects of that work that kept popping up through the project. And now this sort of relates very much to the first point. In terms of the scope, there's sort of a balance between you want to maintain that strong stakeholder engagement. So you want to kind of engage in those questions as they kind of have new priorities and points of interest that arise, but you also need to navigate how you're going to deliver it in the time frame. And then what we noticed at the back end, I think it's funny on the 5 week chart, you'll see we've just sort of got reporting as maybe a week and a half at the back end. In practice, obviously they still need to get out to program areas for fact checking and review and approvals. And it's really hard to force that process in a busy environment like this as well. So we've had to sort of build a back end to this where there's at least a couple of weeks to allow people to absorb it, check whether they agree with the findings and all those aspects as well.
Yep. I'll just jump in here, Eleanor. We've had a few questions. So
right.
First one is around the idea of empowerment, that the way that you conceived of empowerment. So whether it's looking at empowerment across the system or empowerment of individuals.
That's a great question. And I thought it was interesting language. And this is language that was really insisted on by one of our deputy secretaries, who was really keen to think of it in this way. Like, does this model, they're thinking about it in terms, my understanding is, in terms of individual empowerment, is trying to say, well, thinking from the worker, does this give them more ability to deliver the service the way that they would like to? And I think this is, you can see there's some assumptions built into that, or maybe some pre-existing knowledge. Maybe it's building kind of early findings in, is we're hearing from the ground. And this is true, we are hearing from the ground. But there's some workers who said, actually, I've always wanted to work more flexibly, where I could bring, say if you're a housing worker who also works as an alcohol and drug worker, I can bring them into a meeting in a way that I couldn't do previously. So there's some, that was the idea that they were trying to capture in there. Okay. The individual and the community level was trying to say, does this give you back more ownership and decision making about how you might receive a service? So that was the thinking behind it. but there wasn't a lot of time, you know, if you were doing this on a grand scale, you'd want to spend some time actually fleshing out what that means and how you might measure it. And instead we've had to do it much more through discussions, and, you know, with the project teams, we've debated that a lot when we're presenting findings. You know, well, of the things that we've seen through the survey, which of those would represent empowerment? And that's taken some pretty just detailed qualitative thinking, you know, really trying to work out thematically, what do we think would fall into that category? Yeah,
sure. Yeah. There is another follow-up. There's a comment from Liz Curran here as well, saying great to see empowerment named. So I'll use that as the segue, and saying well done on this important work. Question is, how do you manage data collection from some of the smaller services and their input, given they'll be juggling the front line at the moment and may have limited resources? So in the context with everyone being busy, how do you manage to engage?
We've been really worried about that one, actually, but interestingly, I guess we're finding the stakeholders are actually easier to get than usual. And partly it seems that there's a lot of people who'd like to communicate something. I mean, if it's an external service provider, there's a lot of things they'd like to communicate back to the department. And so that's actually a pretty good hook. Okay. And having had to make these service and practice changes on the fly, there's a real willingness to engage, and kind of a lot of people who want to share their stories. That said, I mean, we had, as you can imagine...
Quite cold. You might want more than that, love.
I'll say again?
I think that was just some background comment from somewhere.
Just background noise?
Yep.
Oh, I thought it was a really interesting comment where I got called love too. I was excited and flattered.
Like an offer of a cup of tea.
Oh, I'd love a cup of tea. So just going back to the point. So, but we've been very cautious around approaching smaller providers, because we also do know the demand, but it hasn't come up as a problem yet. We've only completed 3 of the projects, and we've got 5 more underway. Again, it hasn't eventuated as we imagined. We were very worried about that, and it hasn't been a problem yet. And same with, you know, survey responses are much higher than usual.
Yeah.
And whether it's just that people are desperate to share what they're seeing, or if it's they've got more time online that they're using for this sort of thing, it's hard to say at this stage.
Yeah. So the surveys have been the primary mechanism to seek those views, or one of the main?
Well, the stakeholder interviews, they tend to have snowballed more than we intended to. So we've for each of the ones that's been completed, we ran many more stakeholder interviews than we planned, because someone would say, also, you must speak to this other provider. They seem to be doing something interesting.
Yeah.
Yeah.
Another question. So just around meeting timeframes. So did you need ethics approvals in place for any of this work? So
we've consulted on that, and our team provides formal ethics advice. We're pitching it very much as a quality assurance. Firstly, we're not seeking formal ethics approval, but we're taking ethical approaches. Yeah. So we're still using consent forms and all the standard things you'd usually use, but we're not going through a formal process, obviously, partly because of the timeframes, but also because it is genuinely intended as a quality assurance exercise. Okay. Just to say, so we don't talk, so we've been very careful to limit all surveys so that they only speak about the service users' experience of the service, nothing beyond that. Okay. So that's how we've come at ethics. That
sounds reasonable. And a question from Ash was just around the use, ask how you've used observational data for feeding into intervention logic, if indeed there's a link between those.
So we're taking a pretty pragmatic approach to intervention logic. So on this, I feel there's a whole other topic in here, which I would actually really love to run a session on, which is about how you run a good intervention logic remotely, because it's a really hard thing to do. So I guess we're all used to using that. Get everyone in a room, it's post-it notes, it's butcher's papers, it's texters, it's whiteboards, and try and map it out. And often we want to move things around, and it's just very hard to do well remotely. So I guess what we're doing, we're more doing the way that we've sort of agreed and this is not just the rapid evaluation teams, but our broader evaluation team, is to, now I think I'm not sure I'm answering your exact question, but this is how we're doing it, is we're mostly trying to do them as desktop, and then we're testing them out with all the individuals. And if there needs to be a group discussion, we run that group discussion, but mostly we're running it as almost like a bilateral discussions approach. Okay.
Hi, Eleanor, sorry, this was my question. Can I please just add a little bit here?
Yeah.
I might have misunderstood your point, but what I was trying to ask, in your flow chart, you sort of had observational data, the document review one. Mm-hmm. This is something similar to what we are doing internally. And but we haven't reached the stage of turning that into an intervention logic or using all that observational data for an intervention logic. So I wanted to know, were there any challenges? Because this is like next step for us.
Yeah, it's really hard. So that's right. So we are trying to do it. That's exactly right. So it's partly through observation, but partly through consultation with the stakeholders as well. And say for one like the Housing Establishment Fund, it can be particularly hard to guess from the documents because I guess they're pitched around a public health mechanism to say we're supporting people who are homeless into hotel accommodation to make sure they're safe from the virus. But ultimately, the actual intervention still has its previous intentions, which is to say we're trying to make sure that people who are facing homelessness can be supported through temporary accommodation to move into longer-term sustainable accommodation. And that's a really hard logic to draw without consulting with people, because we're trying to say, well, are we still trying to achieve both our objectives, or are we trying to keep people safe for this period? And then there's a sort of what next question on the other end of that. Yeah, so it's a combination of, like, you can try and do lots through the documents, but it's still really hard to do without checking back with the decision makers, I think. Yeah,
right. Thank you, Eleanor.
I've just got one more follow-up, sorry, on that, because I think Sarah's probably dying to hear the answer on the idea of empowerment again. Is it about someone's sense of empowerment that's being looked at, or is it their actual level of empowerment? Because often empowerment's probably measured as I feel empowered. But
I think it's much more about the sense, because if you think about the data that we're working off, we're trying to take from survey data and interview data to say, are we getting the sense that people are experiencing more ability to choose what the service they receive? But we wouldn't have enough to actually know whether people are taking those different choices.
Whether actually more empowered or have more choices available.
Yeah, it's a really good question. As I said, I don't think we've had enough time to really tease some of those concepts out. So we've talked a lot about having to ride the bike while we're building it. That would be one of those examples.
We'll take one more question and then I'll let you move on with the slides, but it's from Jessica Haitley-Brown. So Eleanor, what makes the evaluation rapid in your view? Is it simply the short time frames, or do you think it necessitates different non-traditional or innovative methods?
Oh, both. I think it was named that way for the short time frames. But I guess as we've now embarked on it, we've realised there's actually a whole lot of elements that work differently than our traditional means. So we meet weekly with everybody who's involved in one of these projects. And there's been some really robust debates about what's acceptable to do. And when we I'll show you the sort of, it's the rubric sort of / measures table that we've been using to communicate findings. That was a really big subject of debate. Like, what do we do when we don't have enough data to make a call, when senior stakeholders have said, no, we want you to make a call, whatever you've got now, we'll accept, we're happy to have as many caveats and limitations as you want, but you'll need to communicate what you're seeing. So I think it does actually necessitate different methods and different approaches that might be acceptable, than be acceptable in a longer term project.
Okay, great. So that's all for the questions for now. So let's move on.
Excellent. I'll keep going. So I think I've mentioned a little bit earlier, one of the key features also is we're actually trying to create flexible products because we've got multiple audiences. So these, the body of evaluation work, which encompasses both what DHHS is doing, but also what's happening at Department of Justice and Community Safety, and some other work that's happening through organisational transformation, which is about behind the scenes service and practice changes. That's all getting reported up right up to the Crisis Committee of Cabinet, so to sort of the highest decision-making bodies. And this diagram, I just want to sort of indicate the thing we're balancing is we need to get, for program areas who are responsible for their services, they're really interested in the specific findings around their service and practice changes. For something like perinatal services, it actually, we got right down to the specific appointments that it's most appropriate to run remote delivery, where they don't involve any kind of physical contact. Then we've sort of got the next level up, which is other policy areas who are talking about coordinating ongoing response and recovery activities. And they're interested in sort of the bigger picture, the next level up of detail, the cross-cutting findings that tell you something about how we should be sort of planning our services from here. And then right up to the top level where they're really keen to see, well, what does this tell us at the top level about how their service and practice changes are impacting on the ground? So we've always got to have an eye to all those different audiences, which can be quite difficult, particularly because you've got the program areas right in front of you working with you day to day with specific questions that can sort of take your attention from the other audiences that you ultimately need to serve. And this has sort of moved us, some of you will be familiar with this sort of, there's lots of different versions of this diagram. This is sort of an adaptation from the UK What Works model, which is about how you move from just generating the findings to translating them in a way the audience can kind of absorb and then moving it through to implementation. And I'm really only using this one as a very high level example to say we're trying to push out of just generating the findings. Well, definitely very far into translate, and where possible to work with the policy and program areas to think about how you can actually implement the changes. What does this actually mean? And that's where I was sort of talking about, in some cases we might work with stakeholders, say in Children and Family Services, we're talking about meeting with the Centre for Excellence in Child and Family Welfare to talk through our findings with the sector, and then talk about, look, would it be helpful to start developing some guidance around best practice in remote delivery in this space based on, we did some literature review work at the background of this. We're now seeing some other work out of the ECOS and the Future Social Services Institute looking at this as well. If we're all considering what's leading practice in this space, how do we kind of move that into some practical ways of communicating that back out, right out to the sector? And then I did want to just sort of show you some of the different ways for those different audiences that we're trying to present the findings. So this is, oh dear, someone's rejigged this diagram for me. It's actually missing the one thing I was particularly keen to show you. That's a shame. What's usually here between the rapid review criteria and the perceptions of change is a great big box which says findings. So for each row in this, the main thing you've got, it's sort of produced onto an A4 page in much smaller font than this, is a real focus on the findings in the middle. And this is particularly keen to show the qualitative findings and not just give this perception of change summary. And this is basically to say, for each one, as I was mentioning, we're trying to pick up where the strengths of each model is. So in this case, these are actually the findings that went with the perinatal, particularly the strengths where it does increase efficiency. Example. So this is if you're trying to get a snapshot, where are the things where this thing performs particularly well? Increases efficiency, it increases empowerment for the partners because we've found that it gives more ability to do outreach services that often are restricted in hospital environments. We've certainly seen from the feedback we've got in surveys, some evidence of improved client service experience. It looks like we can sustain it in the longer term, and absolutely you could roll out telehealth to all services. And it's reasonably low cost. So they're the sort of strengths. I guess in terms of measurable impacts or outcomes, we didn't think there was anything particular to say this was better or worse than other services. We saw some things which sort of said improve safety because you're keeping women out of hospitals, but also you've got the increased risk that the nurses can't do risk assessments for other things that they might spot in a routine. The doctors and nurses might spot if you had perinatal appointments within a hospital setting. So this is just to show this is one way that we're trying to pick up very quickly for a very busy audience. What's a summary of the findings? But we found for program areas, even when you're hitting the busier executives, and I'm not expecting anyone to read this slide, this is just sort of to give you a sense, sometimes a one-pager that just sort of summarises the what happened, what impact and what next is the sort of thing that the sort of way to communicate the findings that they can absorb in even just a quick 10-15 minute discussion, and means they don't have to read the full, I think it's a 15-page report for that one, which again, 15-page report from an evaluation report is very short, and a lot of stuff has been turfed to appendices, but still for somebody who just has no time, they might not engage with that unless you can find a quicker way to communicate. And we've also been working, I mentioned the case story approach. This is the first example we did with the Courier Maternity Service. This is just a screen grab of a little bit of it, but really what we're trying to pick up here is to try and step it out in a way people can understand what was happening at each stage of the service practice change. So as you'll see here, we sort of stepped it out through the first contact with the service, the appointment they go through, the standard checks they've been through, And we quite tried to include a lot of these stakeholder quotes to really give you that sense of what it looks like from both sides, so the woman, the family, and the maternity services team, and explain what it looked like. So that's an example, particularly for that career maternity service. They really liked this as a way of kind of communicating between this service that we did the case story on to other maternity services, working with career and vulnerable communities. Here's how you might want to do it. It's a little bit different than just saying, oh, we used to come into the hospital and now we do it by phone. It kind of steps it out what it could actually look like in practice. And we also, as I mentioned, we've got some audiences who are most interested in the cross-cutting findings. And I guess we didn't actually anticipate that we'd have any cross-cutting findings off the first 3 rapid evaluations. But I guess what we've actually got is the first 3 plus the initial stages of another 5 that are underway, plus some findings coming out of the Department of Justice and Community Safety. And so we've been having a crack at sort of trying to tease out some of the high-level findings. I won't go deep into them today, but just some of these findings that just kept coming out from project after project around, video conference delivery being superior to phone-based services because you've got more chance to kind of take visual cues. Interestingly enough, no sooner had we put together this slide, I was talking to VCOS who said, oh, we're hearing that people prefer telephone services to video conferencing. And I said, oh, that's strange. We just all got together and agreed that we think that the video services are working better. But they actually said that had come from a group of alcohol and drug services who are working with older service users. And so I was thinking, we've got to be so careful in these cross-cutting findings because these are short projects. And even where we've got quite a lot of validation across a lot of different people who are working on different content matter, we're still going to have to be very explicit about the limitations because it will still relate to a limited number of service and practice changes, particular cohorts, particular locations. And so it was a good reminder that we need to be very careful when picking up these cross-cutting findings that's in such short periods. And then I just wanted to, for this audience in particular, I haven't actually had a chance to have many conversations about where this is situated in evaluation theory. And actually, I actively avoided using technical language when we were sort of pitching what we would do to an executive audience, because really they were saying, can you just get in there and start finding stuff out? But when I sort of had the chance to slow down and reflect, like, what are we doing here? I think even from that story I just told, I was very much thinking from a utilisation focused perspective. I was thinking, okay, what is it that these senior stakeholders are wanting from it? What do program areas need from it? What can we deliver in this kind of time frame that's going to meet those needs? So I think it is very much from that utilisation focused headspace. So and I think this audience will know there's a big trade-off in terms of pragmatism and purism. Even what you picked up there around that, like the terminology of empowerment, we kind of have to just accept we're going to have to keep negotiating that as we go and discussing it with stakeholders and discussing with programs teams to make sense of what's a realistic definition that we can work with. I also felt, as I said earlier, you can spot very early on some of those connections to developmental. We're not really tied to particular measures. We're still shaping them up as we go along. We're still shaping the method as we go along. And some of those terms like the what, so what next, which are really often quite central to a developmental approach, we were already drawing from them even without using that terminology. So I think there's some elements of developmental. It's definitely not all the way down the path of developmental, but it's got some features. And then participatory, I think these projects are happening really, really closely connected to the project teams. A lot of the data collection is happening either in partnership or in very, very close consultation with the project teams who are delivering the service and practice changes. So I think you can definitely, again, see those sort of elements of participatory and action research sort of principles that are sitting behind this as well. Now, Charlie, I think there might be questions because my screen keeps flashing up with
yeah, sure,
numbers at the top.
I'll start with a comment from Craig Fry. So he said, it sounds, these theories that we're talking about sound quite similar to rapid assessment and appraisal methods from the public health field. So I don't know if you've come across that. Yeah.
We've had some conversations with both the public health field and the emergency management fields. Definitely all of them seem pretty similar, and a lot of it does seem to be how quickly can you collect insights and validate them at least a little bit and then get them back to the people who need them. I think that's a sort of underlying principle. They're definitely the sort of places we're still in close consultation with the Public Health Intelligence Unit in DHHS and we're just setting up some connections in with Emergency Management Victoria, because I think that's where the real knowledge about how these approaches work comes from.
Yeah, sure. Another question. So, is it in scope for your evaluations to understand the organisational experience in responding to the pandemic? So, is it about organisations and the things that they're doing?
I'd like to hear a bit more about where that question came from. Like, what's the thinking behind it? But there's sort of a separate piece of work. So we're not doing a lot of work with the agencies to understand their experience, but there is this work I sort of referred to from which BCOS and the Future Social Services Institute and RMIT are leading, which is out there trying to understand the experience of community service organisations during this period. And in DHHS, there's organisational transformation. I try to do some understanding of what's happened behind the scenes, the move to flexible work, what's been the impact of that, some of the other changes around approvals and new technology that we've taken on during this period to understand the impact of that. Was that the sort of intent of the question?
Yes, Eleanor, that's right. I actually asked this question because I work at Primary Health Network, and for PHNs, it's very new, being new organizations to respond to pandemic and play a role in it. So for us, our evaluation focus, along with looking at what things have made some changes and empowerment, we also want to look how organizationally things were adapted and what are the lessons for future. But yeah, I get your point.
Yeah, look, and that's been, so the work that's happening internally at DHHS is intended to capture that. And I would say, I think there's a little bit, there's two ways that you can come at it too. Like, there is just a sort of a curious, what's happening, how does this change organisational dynamics? I do think there's sort of an executive level interest in how it can also increase efficiencies. Like, there are a lot of efficiencies to be gained from flexible working and that sort of thing too. And like, I don't think anyone would want that to be characterised as just a cost-cutting exercise, but there's interest in this because I guess for a long time, all organisations have been thinking, is there a way that we stop spending so much money on having a seat and a person and a office space and all the things that go with that, to some of the use of technologies that lots of organisations have tried to drive for a long time and is now just suddenly taking off.
Yeah.
I have a question on the methodological elements. So have you changed your data collection techniques, for example, surveys or interview methods, to make them more rapid?
Yeah, we have, and we have debates about this a lot. Again, that sort of goes to the scope question as well, because we're trying to hold the scope down. We're also conscious people are busy, so we're trying to keep surveys from blowing out over, I can't actually remember where we've landed. I don't think there's anyone from the teams who's on the call today, but if there is, feel free to chime in. Most of the surveys that I've reviewed have been sort of 10 questions or less, and we're sort of aiming for a 5 to 10 minute maximum completion time on the surveys. Interviews were a bit more relaxed. Again, we are trying to, if people say they've only got half an hour, we'll just do half an hour. But what we're finding is people actually tend to be more generous their time than less. So we're actually finding that they've blown out a lot. So people who factored in, I think I'll do 6 interviews, I should be able to do them all in a day. Then it snowballs to 11 and 12 because they've all said, oh, you should talk to the other person I've also been working with. They want an hour. So the time taken for data collection has increased, but has been more than we factored in, I think. But we are trying shorter, sharper versions of those data collections.
Okay.
Mechanisms.
Sensible. And have you, on the utilisation focused idea, have you found it, I guess, easier for policy decision makers to use findings from the rapid reviews relative to other types of evaluations perhaps that were being done in the past?
So I'd say, that's an interesting question. It's sort of, we are trying to tailor them a lot, which does mean it's sort of easy to interact with. If we're producing it in the slide, it's hard to say, well, I don't have time to engage with your evaluation findings. And there's, we're doing a lot of verbal briefings and trying to just be in the room when there's a discussion happening about what next. The trickier thing would be, if you consider all those limitations and shortcomings, is you also don't want to overstate the evaluation findings, because it gives you lots of guiding information. Like it's I think anyone agree it's better to have some information than none in this kind of environment. But there's also the risk, if you overstate any of the findings, to say, look, it's based on 4 weeks, and often they've just been implemented. So who knows if this holds up when you get further down the track.
Yeah, sure. It might be more about the appetite of the senior execs to
Oh,
take
yeah.
forward the findings and use the findings?
100%. So that it's a very, very engaged stakeholder environment that you couldn't wish for in the normal environment. You couldn't wish for more.
Yeah, great. There's another question that probably follows on from that. I mean, are there some elements of what you're doing now that you would love to take forward beyond a pandemic of this nature?
It's a good question. So I actually was speaking about this earlier to an internal audience at DHHS. We've got a tricky thing. So I think, the team's really invigorated by the fact that you do have this incredibly engaged stakeholder environment. And people love getting findings within 4 weeks. Everyone's thrilled and they can stay, you don't lose anyone's attention over a 4-week period. The tricky thing for us is we've actually been on a different journey, which is trying to push harder into the more longitudinal, more quasi-experimental design, more impact evaluations to try and build the evidence base for the Department of Health and Human Services about the interventions that are most effective and, using the full benefit of our linked data access. So that we've been pushing in a really different direction for longer, bigger projects. And now we've got an appetite with these shorter projects. And I think it would actually be really hard to resource both at once. So while I think people like doing this work, both on both sides. So the audience likes it and the work, people working on this stuff like it because you get more immediate payoff. But on the other side, it is quite far away from the sort of other objective we were trying to push around robustness and trying to understand the long-term consequences of projects rather than and making assumptions in short periods of time. So there's a real tension there.
Yeah.
Between
there's some great questions coming through. I'm more than happy for people to ask them in their own voices rather than me trying to paraphrase awkwardly. So if there was anyone, so Emily, you, Patricia or Mandy, if you want to put your question to Eleanor, I think it's probably happy for you to do that verbally.
I'm happy to ask a question. Noel Nidri here.
Sure.
I know.
Hi. Is there, stakeholder management is always a big issue, and you've got a fairly, it would appear, compliant, understanding stakeholder group. Is there a possibility going forward that you've got a mixed methodology, like where we run longitudinal study with rapid pieces underneath? I mean, that would be resource intensive, but given that you're in an environment where stakeholders are keen, is that an approach?
That's a great suggestion. Look, that might be the middle option. That is the best solution. We haven't quite got to that yet, but I think that's possible. It clearly shows the appetite, and this is something that's known, right? Like it's a long-term complaint that evaluations, you have to wait too long for the findings and they're no good for you. It's why there's so much interest in developmental anyway, because there's more feedback loops built in and it's more kind of engaging and there's a bit more frequency of that kind of input. So I do think, yeah, there's definitely something in that.
Thanks.
Yeah, I just have a question about the short-term and long-term outcomes. Because for many programs, in the beginning, according to the design, you usually examine maybe longer-term outcomes. But now you need to do the rapid evaluation. Does that mean you need to reconsider your outcome measures or even reconsider the program design to create new outcome measures?
Oh, it's interesting. So I think I understand your question, which is to say, so if you're looking at the short term, can you consider the outcomes at the different kind of points in time, like what are the longer term outcomes we're aiming for? Yeah. Well, so I guess we're trying to achieve that through the program logic, like trying to understand what's the, where this sits in the short, medium, long term objectives of the program. The tricky thing is, look, we'll have a couple of them where they cross over with longer term pieces that we're doing, and so we'll actually track through. But for a lot of these, we wouldn't be able to resource all of, we've got, as this slide sort of quickly summarizes, we've got 20 rapid evaluations that we'll do over the next 6 months. If we were to take them on as longer term projects as well, it would probably blow out our staffing. So there's a tricky thing there. I think we need to hold it. The good thing is, having done program logic at this point, we'll set areas up to monitor those outcomes into the future. But I think there's a resourcing question in there about whether you do or don't do it.
Just on staffing, while we're on the staffing, what sort of team are you putting around each of these reviews?
Yes, it's interesting. Initially, we totally underestimated what would be required and we thought we could do them with teams of 2, which you can't. It's just there's too many steps. You can't have someone who's designing, deploying, analysing a survey at the same time as conducting, organising, conducting, transcribing and analysing interviews and writing the report and, coordinating stakeholder responses and the whole works. So I think the ideal size is at least 3 and probably 5. If you're going to do them in the 4-week period, obviously if you extended longer, you could do it. It's actually just that so much has to happen concurrently. Like you can't get someone with enough headspace to do the literature review if they're busy setting up interviews. So there's a team of 3 that's tracking along, is likely to do a series of these kind of telehealth in their health settings because we've got a very high demand for that. And they've kind of got themselves in a groove now where they've split up the task. But so I think at least 3, and they've got to be a pretty experienced 3 because they need to be able to do data analysis, survey and interview analysis and report writing pretty competently.
Okay.
It's Mandy Charman here. Hi, Eleanor.
Hi, Mandy.
I didn't really have a question, but I just want to applaud your pragmatism and ability to adapt from, that to balance out between, the importance of sorry, I had an intruder. The importance of a robust evidence, time horizon, and proof. Well, at the same time, you can use the same techniques for other types of purposes and other types of audiences. And, it's commendable being able to enlist such support, and it takes a lot of skill to redesign and re-articulate what you're trying to do. So I think, it's a really good effort, really informative, so thank you.
Well, we'll be over to come and work with you on communicating with the sector soon.
I'd love to. We've done a little bit in this space as well, nothing nearly as comprehensive as this, but there's a huge appetite for understanding this more fully. And some people are actually trying to initiate this themselves. So I'm sure the efficiencies gained from learning from what you're doing rather than doing it themselves would be really advantageous to the sector.
Yeah, that's a good point. And Patricia, I think I heard you for a second there, then it faded out.
Thanks, Eleanor. It's really terrific to hear about the work you're doing, to be making evaluation really useful in this crisis. So thanks for all of that. And I was just struck when you were talking about, what, so what and now what, which is very useful framing, and wondering that there seems to be something missing from that, which is a bit about the how. And I wonder if there's an opportunity when you're doing these interviews with people in these cases to ask them, what is it about it that makes a difference, or what's needed to make this work that might really add some value. I'd just be interested in your thoughts on that.
We did talk, and I toyed with putting on, so the team, we've got a number of team members who are really passionate about realist evaluation methods, and they were particularly keen on whether we wanted to use CMO, like context, mechanism, outcome as the framing. And we went back and forth on that, and ultimately we decided that this sort of terminology and way of communication was more intuitive for a wider range of audiences to absorb. I agree. I think we're probably missing the mechanism stuff a bit, but we do try to delve into it in the interviews. We've struggled to try and nail what the interview question is that draws that out most effectively. I think the one you used is basically what we use as well. And I probably could dig up an interview schedule to demonstrate this, but where we're saying, what is it that's working? What is it that's working well is a question that's in there, which is on the back in the kind of what happened.
I guess, the realist opens up a whole lot more, which, might be difficult in such a short space. I guess what I was talking about was much more not just what's working well, but what is it about it that makes it work well, which can be a conversational question. And my experience in some things has sometimes come down to, people feeling respected or feeling they can trust you. So it's not about context and being different. It just, and I think unless you ask that question, when you're trying to scale it up, you might be just repeating some of the external factors rather than the essence of it. So we're just interested in that.
Well, that's a really good point, Patricia. I'll take that back to the teams too. So I think that is something, as we kind of refine the approach, that is something we could do better.
Okay, so just to jump in, because the audio is a little hard to hear. So really it's about how can we understand what it is about the intervention that is working or not working, and further, more deeply unpicking the mechanism that's creating the change or driving the change. So for those,
I think more Patricia's saying that not even the mechanism, but the how you deliver it, which is that sort of, would you say like some of those aspects, like the relational aspect and how you build, like the Curie maternity service is a great, like I think the case story told us lots about that, which was they didn't say to the pregnant women they were working with, we're flipping you from, you can't come to the hospital anymore. We're just going to phone you. They organised a way where they could physically get out there. So they'd drive out, they'd talk to them in the front yard. They were trying to maintain that relational aspect of the service that they provide. And that's why they were keen to have a case story done, because they were keen to communicate, you know, we're doing everything we can so it doesn't feel like we've left them. You know, you used to be able to see us and you can't see us anymore. They're trying to say, look, we're here. We're going to drive out to your house. I'll talk to you on the phone for a few minutes. We're going to come stand in your front yard for a bit. I'm going to go get my monitors. I'm going to like use all my sanitizer. We're going to do a quick thing. And then, and if you need me to see you more frequently, I can drive past again tomorrow. It's like a totally different kind of experience they're trying to create. So that was, I mean, that was a great, like you can spot that case story mile off as being a really interesting one for other Curie services. You know, one service has tried to document what they're doing. We're hoping to pick up more of those examples as we go along, where we can talk more about what does it look like on the ground when it's going well. Yeah, but I don't think we've captured it as the basics of the methodology yet, Patricia. I think we've got it, that relied on a person spotting it in the team.
So Eleanor, does that mean that things like contributory analysis and realist analysis is out the window for you for the moment?
Not on our longer term projects. And the team still, so we've got a couple of team members who are really passionate about contribution analysis in particular. And they're still feeding into our other projects. But I guess for this work, part of the reason is, like, I think we're trying to pick features of that, but we're not running full methods on anything really, are we? Like, it's a very pragmatic, someone called it, I think, a belt and braces approach. Is that what they call it? Like, this is just get in there, pull together what you've got and try and report it in the most practical way. So I guess we're trying to hold the spirit of those, you know, I'm still trying to manage, make sure we have team meetings where we talk about method and more complex stuff, while also delivering some of this fast-paced, more pragmatic work.
The 20 rapid evaluations, what are they in? If it's not like, and are they internal?
Can you explain more, Noel?
Well, what are you doing? The 20 rapid evaluations across where? Did I miss it? Did you mention where you?
I did a quick one here. I'll jump back to the one which is I listed the first 8 topics. There we go. So they're across all the health and human services portfolios, but there's also parallel work happening in justice. So there's another 20 happening in the justice and community safety space. And also another set of internal ones, which are about the back of house stuff, which is the flexible working, some things around digitalisation of internal processes, that sort of thing. So the ones that my team are leading are all about external facing service and practice changes across health and human services. And we're trying to balance cross portfolio. So we have tried to pick up, we're still trying to pick up one on Aboriginal services, but we're just struggling to nail the topic. And we're trying to pick up some more in the disability space as well. So some areas we're very quick to volunteer. Here's a service of practice change we're really keen to pursue. Can you come have a look at this? And some project areas are still, you know, they're still rolling things out. They're busy, they're distracted. They're still thinking through what they'd like to look at. So we've still got space for a couple more at the end of our process, which will happen more like in November.
Okay, thanks for that.
All right, we're pushing close to our hour, and it's probably quite nerve-wracking having 70 odd evaluators evaluating your methods for a department. But on the flip side, it's probably a useful resource. So I guess maybe as a finishing question, is there anything, Eleanor, you would want to put to the group, or that you're that you're debating in your mind about the
Such a good question. I had actually included questions, but I wonder if there might be a way to do this as an offline thing. Charlie and I also talked about whether we could do breakout rooms and that sort of thing, but we thought they're actually bigger, harder questions than is probably suitable for that. So I would really welcome this group if you did want to email me through your thoughts on these questions, and we can maybe email them out to attendees. I guess what I was hoping to get from this group is was any guidance you have, and I've really valued those couple of comments that have already come in about opportunities for improvement. You know, we're still refining this approach, and we're really open to try and do it better. And if there was alternative models, because we could be running a slightly different, like we've got one that's operating very differently around the communications with cold communities. But I'm open to if there's other alternative models. You know, we've touched on public health models and emergency management models, but other kind of examples that might be helpful. I was also really interested in that question about how others have communicated findings to busy audiences. Like I'm finding the verbal briefings that probably get the most traction. I'm very interested in that question as well. Mm. One other question, this is actually one I was talking about with my executive director, was about like where does the role of the evaluator stop? Because this is interesting now. We've got people, tranche one's technically finished, but we've got people out informing cabinet submissions and talking about running roundtable conversations. And so it's sort of, even though the sort of 4 to 6 weeks is completed, it's possible we're going to have a very long tail. And we were interested in whether that actually gets into a question of independence. Like if you're the evaluator and now you're out trying to actively influence the policy, have you actually overstepped the mark of the kind of independent evaluator who provided advice and let you deal with it as you could? Mm. And then finally, I was just curious about whether other people will try and use this in their organisational sector as well. And if you are, I'm sure we could think about how we could try to share templates and maybe even some examples. Well,
let's share the presentation at the least with the group if you're happy to do so. And then maybe offline you can take any comments or further dialogue with people who have things that they feel would be useful to feed back to you. If that's
brilliant. That would be wonderful.
So yeah, we've had all sorts of participants dialing in. So Liz has left the call, I think, but called in from the UK. So you've spread your ideas far and wide. So thanks very much, Eleanor, for preparing the presentation and being so open with us at pretty short notice. So we originally planned a seminar on lapsing program evaluations, and given the budget's been delayed and COVID's come along, I think this has been a much more relevant topic and really well presented. Very interesting practice change for the department, and obviously a lot of work being done internally to produce the 20 evaluations over the next few months. So good luck for the next phase, and thank you very much for your time and sharing your knowledge today.
Oh, thank you, Charlie. Thanks for sharing.
And thanks everyone for dialing in, and